The World Health Organization has named Mpox a public health emergency of international concern for the second time. This is coming on the heels of cases skyrocketing in Africa and the continent sounding the alarm, asking for international aid. The CBC's Albert Delatella is on the story for us. Albert, what should people be aware of?
Well, Abby, it's the second time now that the World Health Organization has declared a public health emergency of international concern for Mpox. And we heard from them on this just this past hour, and it follows outbreaks in Congo and elsewhere in Africa with cases seen among children, adults, in more than a dozen countries there. You can see in some of those visuals there the symptoms of this condition, Mpox, which was known as monkeypox, known for causing painful pus-filled lesions, also can cause severe illness or even death as well. It was first in the headlines a few years ago, the summer of 2022, after an explosion of illnesses then, and that's when the last public health emergency like this was declared by the WHO. That lasted about 10 months. The WHO, says that in this current outbreak, the cases have actually exceeded the total number seen in all of last year. So they said about 14,000 cases so far as well, 524 deaths, they say. Here's more from the Director General from the WHO.
Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice. The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying.
So the WHO says that it's working on the ground in affected countries with its partners there. It says it's supporting laboratories to sequence viral samples, training health workers, supporting clinicians to provide appropriate care, also supporting countries to access vaccines and helping them with rolling out those vaccines. It does say that it has developed a regional response plan here, and it has released $1.5 million from a contingency fund that it has, but it is appealing to donors to provide more money as well. It says that it's committed to coordinate the global response, working closely with those countries and leveraging its on-the-ground presence to treat those infected, prevent transmission, and ultimately to save lives. Abby.
Thanks for this, Albert. The CBC's Albert Delatella reporting from Toronto.